Hi everyone, welcome to part 2 of our trigger point series. Today we're going to talk about some points that can cause shoulder and kind of mid-upper back pain, as well as pain into the arms and hands. So the first one we're going to do today is actually a neck muscle. It's called the scalenes, and it's right in the side of your neck here. So if you watch our last video, we did the sternocleidomastoids, that big ropey muscle on the side of your neck there. So this one's just behind that. It feels a little bit more flat. And it can send pain in the upper back, the chest, the shoulder, even down the arm all the way to the hand. It can also give you pins and needles in these areas as well. Okay. Very simply, you're just going to take your fingers and you're going to find that sternocleidomastoid muscle, go just behind that. And if it's really tight, it can feel like guitar strings. So you're just going to use your fingers. It goes all the way up behind your ear again, a little bit farther back. And you can work all the way down, find some different points. If you find a good point, you can stop holding it for 30 to 60 seconds or until it starts to fade away. And it goes all the way down deep into the collarbone area here, okay? So find a couple good spots there and work through that. Now while you're working, you might feel some of those symptoms if you do get them, the pins and needles down the arm. And you might find as you start working on these, they'll start to creep up until it's gone. The next muscle we'll do is the rhomboids, which are in the mid-back between the spine and the shoulder blade. So they fan out across your upper back there. These can cause pain in that shoulder blade area or in the mid or upper back. It can feel like that burning pain sometimes, especially if you're sitting at a desk or working with your arms a lot. So we're going to use a ball against the wall. You'll find your shoulder blade right on the inner edge of that, and you'll lean into the wall, and you can either hold a spot that feels good, or you can roll slightly back and forth on it. You can also use the Theracane or an S-cane for this point. Same idea, you'll find that shoulder blade edge, and you can move just off that. There's usually a good spot there. The third muscle is the pec muscles. So these are a muscle that fan across the chest up towards the shoulder. So again, this can cause pain in the shoulder, in the chest, or down into the hand along the arm as well. Again, can give you pins and needles. So with this one, a ball works very well against the wall. So you place the ball on your chest, just shy of your shoulder there, and lean into the wall. And again, you can just push in, or you can roll a little bit on the ball till that releases. The fourth muscle we'll talk about today is the latissimus muscle. So it's quite a large muscle, but you can often get trigger points right under the shoulder here. You can kind of grab onto it. Now you could release this just by grabbing on. I find a ball works really well for this one too. So this can give you pain in that shoulder blade area or the back of the shoulder, all the way down into the hand again. So using a ball against the wall, just go underneath your shoulder. You'll have to move your arm out of the way, lean into the wall, and just press in or just roll around on a good spot there. The last muscle we'll talk about today is the infraspinatus, which is one of your rotator cuff muscles. This can cause pain down the front of the arm into the hand or in the back of the shoulder. So how to find this one is if you put your hand over your shoulder, you'll feel a bony edge there. So it's right underneath that along the shoulder blade. So a ball can work really well. Just put the ball against the wall, get under that bone, and roll around or apply some pressure. Or you can use the cane, same idea, find that bony ridge, go underneath, and apply some pressure. So those are today's trigger points. Look at our video for next week, and we'll talk about some lower body.